In his first weeks as the new commissioner, Sir Mark Rowley singled out dealing with mental health issues as a major distraction for his officers. Too many hours spent waiting with patients in hospital emergency centres. Not enough time, said the commissioner, preventing and fighting crime. Retired Met Police officer Chris Hobbs blamed public health spending cuts.
The only one I remember dealing with was someone threatening suicide from the top of a bus garage. Now, we managed to talk him down, got him on the floor, and we just took him across the road to where there was a very large mental health hospital. Mental health hospitals have closed or been reduced in size. The whole mental health service is under stress, so the police have had to pick up the slack. And basically they've said, well, we can't do this anymore.
The commissioner says from the end of August, his officers will stop answering emergency calls involving mental health patients unless life is at risk. In a letter to health and social care providers, Sir Mark Rowley wrote, "Every day that we permit the status quo to remain, we are collectively failing patients and are not setting up officers to succeed. In fact, we are failing Londoners twice. We are failing them first by sending police officers, not medical professionals, to those in mental health crisis. We are failing Londoners a second time by taking large amounts of officer time away from preventing and solving crime, as well as dealing properly with victims." He said officers were spending more than 14 hours handing patients over to medical staff, taking up 10,000 hours of officer time each month. Last month, he said, only 30% of 999 calls were actually crime-related.
I think it is worrying for patients and service users of mental health to think that in London at the end of August, there is no other number to call. At the moment, there is only 999 that relatives can call when someone's in that crisis, and that's not going to change between now and the 30th of August.
Scotland Yard has called for an urgent meeting with health chiefs. The Commissioner is confident in his threat to stop responding to all but life-threatening mental health crises because he knows it's worked elsewhere. A pilot scheme in Humberside brought police, health and charity staff together. It's been praised by the Police Inspectorate for giving patients better care and freeing up crime resources. It's a model known as right care, right person. It could be adopted nationally, eventually, but the Met says it can't wait for that. Martin Brunt, Sky News at New Scotland Yard.